Disease and patients. This is fundamental to our inputs and understanding of health services. And as many of us are clinically trained, we go through our university thinking, this is a drug, this is a disease. This is how we diagnose patients, this is how we treat them. But very rarely do we consider disease as a social concept, that actually these are not fixed. It is fundamental to how we define and study health services, because how we define healthcare and what we do is so much driven by what is fundamentally what the patients are, what the disease are. I think it comes down to two crucial questions. What is disease? What are diseases? First of all, what is disease? There are two approaches to define disease. Firstly, it's a self-assessment. It's a felt need, a need for health. Oh, I have a really bad headache today. That is my self-assessment. It's inherently subjective. You don't know how bad my headache is. It's really bad. It is just really bad, my headache today. So you as a doctor can't tell me how bad my headache is. It is very a personal experience. And I don't know what your headache is like. Also, people, what they do and what they expect from headaches vary. The Stoics think, I'll just sleep it off. It's a headache, I can sleep it off. I don't trust pain medications, no way, sleep it off. The hypochondriacs, on the other hand, is like, oh my goodness, it might be a brain tumor, I better go see my doctor now. And then so, it is very variable. And this is all a subjective assessment. It's not concrete in any way. Then we have a different perspective of disease, the biomedical perspective, which we are all very familiar with in our professional capacities. We call this sometimes the need for healthcare, a normative need. And it's normed because the doctor or the professional says you have a disease. It's objective. It's often based on combination of signs and symptoms and measures, probability, blood tests, statistics. And we say, oh, it's likely that you have this syndrome or this disease because you have these symptoms. You've got pain and you're right. Iliac fossa, umbilical pain, and you're nauseous and vomiting. You've not got an appetite. Very tender. Maybe you have an appendicitis. That kind of diagnosis is a biomedical, normative, objective, and decided, crucially, by a healthcare professional. So what is disease and what is not? We go through our training thinking, disease is one thing. Well, actually, would we say traditional foot binding in ancient China is a disease? If you look at the x-rays of women who had the foot bound, you'll be like, oh, disease, so many fractures. But actually, all women had that. There was beauty, not disease, not seen as disease in the society. Why is your foot not bound? It must be bound. So, back then it was not disease. Now we look at it, every orthopedic surgeon might gasp and go, oh gosh, painful, something like that. Malaria, many countries, in UK, if you've got parasitemia, you have malaria. In endemic countries, most people have asymptomatic, they're not considered a disease. Mental health, really interesting. So the studies suggest that 165 million Europeans a year suffer some form of mental disorder, mental condition. 38%, that's a lot. What does it mean? Where's the boundary? How do we define? If you were sad sometime in your year for a period of time, are you depressed or are you just sad? Are we as a society saying that we shouldn't be sad, we should all feel great, feel normal? If you have a period of time where you're sad, you have a mental disorder. Not saying it's not important, but it's interesting how we perceive it. In society, a fourth leading contributor to the global burden of disease is indeed important. But it's how we, as a society, come to define disease is interesting, isn't it? Interesting articles here, controversial, but which side do we put people? In a sense, it's a label, isn't it? How do we label people? you're just slightly odd and eccentric, you're just slightly odd and different, or if you've got a mental disorder, a personality disorder, it is very, very up for debate. So some interesting conversations there that talks about how we define disease. This is a very interesting study from some time ago in the 90s in England, looking at the reasons for retirement of different public body service sectors, the public sector workers. Armed services, only 6% retired from ill health. Fire officers, 73% retired of ill health. Is it because they're all getting really sick from their, firemen getting accidentally burnt in the work? No. And then whereas armed services, everyone's really well. It's actually because for their financial protection and retirement protection. So as an armed fire officer, you retire with ill health. You're protected, you're remunerated for your contributions financially. Whereas actually, if you were in the army, you were protected anyway, so you don't have to retire with ill health to have those contributions given to you to protect your entitlements, etc. So it's very interesting, isn't it? How people define disease is not fixed. There's also geographical variation. Some areas in England, police officers were more sick, 60%, more than 60%, and then some officers were 20% less. How interesting, local government as well. Really? Local government, and police officers being 2 to 3 times sicker in some areas? It's very odd within one country. So when they quit their job, it's how they record the reasons. So for the fire officers, because they were going to be protected financially, if you left your work with an ill health, so they record themselves as is recorded as being sick, whereas others are not recorded. It's just to highlight the discrepancies of recording, but also how we define disease. Is it a bit of stress? Oh, I'm very stressed. I must go down in my medical notes as stress.
So
Yeah.
I'm very surprised because in Japan,
Yes.
the public servants never quit their job. It's a very good job in our society.
Yeah, because if they quit, they don't get paid with a remuneration. I mean, this is not necessarily quit. I think it's retirement. So, yeah, I mean, there is a bigger question as to why are fire officers retiring? Are they retiring prematurely? This is not clear, but they're retiring with a reason for ill health and not. So many different reasons. There might be many, legitimate reasons underneath. I'm not saying it's all spurious, but it is interesting that if we consider it in perspective of how come these people are so sick. There are many implications for disease classification. Just to put down there are employment rights. If you've got such a good job, you don't want to quit. Japan public servants, it sounds like very fit and well till the end. Insurance companies, compensation. Oh, whiplash pays out so much, doesn't it? So many cases of whiplash, documented in the States when the insurance companies changed their policies. Lots of other reasons. So, what are diseases? It's a pattern of factors that occur in many people in more or less the same way. As doctors and pharmacists, we would know that very easily. But how do disease categories arise? There are really 4 reasons. Real changes in occurrence, changes in name, changes from a single to diverse categories, and the changes of recognition of abnormal. We covered some of the last point already. But some examples of what these might be. Real changes in occurrence, HIV/AIDS. Jia Sensei works in that field. Before the 1980s, no one's heard of that before. It didn't exist. It's a real disease that emerged. SARS, similarly, in our lifetime, that was a new disease, or new that we've recognized it. Changes in name, coronary heart disease, what it used to be called, unstable angina, had changed many years of name. Before that, it was something else. Subdivision of diseases, diabetes mellitus, diabetes insipidus, type 1 diabetes, type 2 diabetes, more and more different categories, and there's probably more and more you can list your name. So we also have changes in the recognition of abnormal. Not very long ago, Germany was still treating for low blood pressure. So it was below 90, it was unhealthy. It was systolic, so they would raise it. It was interesting, isn't it? I don't know if Japan treats low blood pressure. But we're also uncovering previously rare conditions as well. So we also talked about the importance of diseases classification for socioeconomic implications.